Hi classmates, my name is Liana Suarez Cabrera. I was born in Cuba and came to the United States when I was 11 years old. Growing up, I always admired my mom, who is a nurse, and I dreamt of following her footsteps. After years of hard work, I'm proud to say that I was able to accomplish that dream and become a registered nurse. I've been working for about 10 months on the MCVI, or 4-path, how we call it, floor at South Miami Baptist Hospital. During this time, I've learned so much about patient care, teamwork, and how important it is to use evidence-based practice in daily nursing. I'm excited to be part of this class and look forward to sharing experiences and learning from all of you. For this podcast, I want to talk about what is called a sacred cow in nursing. Sacred cows are practices that continue simply because that's how it is, and that's how it's always been done, not because there's a strong evidence supporting them. Both of the articles we read, 7 evidence-based practice habits, putting them some sacred cows out to pasture and sacred cow gone to pasture, highlight how these practices can persist even when research shows that may not improve outcomes or could even cause harm. The sacred cows I want to discuss is the routine practice of giving every patient on the floor a full bowel regimen, including medications like Colace, Senna, Miralax, and sometimes Pepsin, regardless of their individual needs. I've noticed this is often done automatically upon admission, almost as a standard protocol, without assessing whether each patient actually needs it. While the intention is to prevent constipation, the evidence shows that routine blanket administration of these medications can lead to unnecessary side effects, like diarrhea, cramping, dehydration, and electrolyte imbalances. It also increases medication load for patients, and it can mask underlying issues that might need a more targeted approach. From a nursing perspective, we are in perfect position to advocate for individualized care. This means assessing each patient's risk factors for constipation, reviewing their current diet, fluid intake, mobility, and medications, and then tailoring the bowel regimen accordingly. This approach reduces unnecessary medication use, prevents potential complications, and provides patient-centered care. I'd like to invite a couple of classmates who work in med-surg or similar floors to watch this podcast or listen to this podcast, and those would be Luis Gonzalez and Laura Gutierrez. I think we could have a great discussion about how this sacred cow appears in our units and strategize for addressing it together. Collaboration could include sharing best practices for individualized bowel management, reviewing evidence-based guidelines together, and supporting each other in communicating with providers about the patient's specific needs. By doing this, we can move away from habit-based care and toward evidence-based, patient-centered practice. In conclusion, challenging sacred cows isn't about being confrontational. It's about providing and improving patient outcomes, enhancing safety, and strategizing our practice as nurses. I'm excited to collaborate with all of you and continue learning how to integrate evidence-based practices into our daily work. Thank you for listening.